Well, I'm really saying that if a child is born feeling bad, that in the course of
I don't
the
know.
conception there was also the seed of...
Don't know. Yeah, it's a really good point though.
Doctor, can I just ask you one quick question?
It's Lucy.
All the surveys that you've done, how many of the children within your programme have only a mother?
It's a very good question, and what's complicated about it, we try not to talk about whose mothers died and fathers died, because for most of them there's no father around. For the vast majority of these children there's no father around. There sometimes is a man around, but he's not necessarily the father.
He's transient, with a protector at the time, or whatever it is.
Well, there's sometimes a grandfather around or an uncle in the household, but it's quite a low percentage of our children have a two-parent family where both of them are the biological parents. And that's different in different countries, and it's a bit different in the rural areas. It's a bit more likely in the rural areas. But it does mean that when we talk about children who've lost a mother, very often that means that that child is effectively a double orphan. They don't have a mother or a father.
And also, when you talk, sorry, I'm apologize.
No.
When you talk about transactional sex, quite often, isn't it true that quite often the elder girl is looking after a lot of younger children because the mother is either not there, has died, or she's going off to earn a living because the father's never been there, and therefore the girl has to look after you, and therefore she's desperate. She has to find a way of earning money, and that must be...
And that's absolutely, if we look back at the findings on transactional sex, that's exactly what we're seeing. We see, if you look, we're going there, you see this massive risk and this massive rise when children are hungry. We're also seeing a massive rise when they're living in an AIDS-affected family, and those two together suggest that this real desperate need is pushing them into these sexual relationships that they wouldn't otherwise be in. But what we also see is that abuse is playing a link in here, and there's something about having a family that's not able to protect you as well that's leading to this real risk. Yeah.
What active role is the South African government playing in all the research, and how do they see their role once the findings are released?
It's a good question. It's been a long road. Things were very difficult several years ago with the Department of Health, and they've improved a lot. Essentially, they're very engaged. They plan this research with us, and they make sure that we're asking questions that they want. So they're very engaged to get the answers. What they're limited by is their own resources, their own financial resources, but also their own human capacity. They know that most of the real intensive work done with orphans and vulnerable children in South Africa is not able to be done by the government. It's done by NGOs. And so what they're doing, I think, really well is working with NGOs, and I attend a national working group of government and NGOs where Starfish attends in South Africa, where they try and work together on policy. I honestly think, actually, in this case, they're not the bad guys. They're doing the best they can, but they're very constrained, and they know it.
Can I go for one more?
Yeah.
And then, are there parallel studies being undertaken in other countries where AIDS is prevalent, or is this... How did you come to South Africa? I don't know much about your initial background. How did you come to...
I'm from a little town called Hermanus in the Western Cape, and I lost my accent when I came to Oxford. Yes, Oxford was not... They call me a colonial, which is true. But that's why I do research in South Africa, and I'm a South African social worker. But is there research being done elsewhere? There's a study in Zimbabwe that does have some data similar to this, and we're going to be working with them to try and see if we're seeing the same patterns. But otherwise, there's very little. This is the evidence, and the countries like Botswana and Mozambique and Swaziland, and even going up as far as Ethiopia, are using our evidence from South Africa because they don't have their own. I hope I haven't shocked you all into silence. Yes.
Just take a couple more, and then we're a small group, so we can chat over.
I just wondered if the churches or Islam have any influence on the children and families.
It's a great question, and it's something we're just starting to look at. the church is particularly concerned, actually, and also the Muslim faith organisations are particularly concerned to think about how they can best help. And I think there's often tensions within religious organisations about sex and HIV, and it can make things more difficult. We're just about to have some findings where we talk to 150 orphans in depth about their experience of churches and mosques. And before we tell anyone those findings, we're going to show them first to the religious bodies, because we think that's probably the most effective way of having change. What we can tell you is that children who, from the national data set of 6,000 children, that children who perceive that they get good support from their church, from their pastor or from their imam, and particularly from the community, do better than children who don't. What we don't know is how do we make sure that the kids get that support. I think we still need to do more work to understand that. It's clearly for some of them a real haven. And we actually did an exercise where we asked kids to build their own church or mosque. And we got them to design what they would like their church or mosque to look like. And what was amazing about it was that there was nothing spiritual in there. They wanted a youth group which was somewhere they could go after school that was safe from the gangs. They wanted, lots of them suggested having Alcoholics Anonymous in there, and places. They wanted counsellors, and they wanted support. And they were very clear that that's what they wanted from their churches and mosques. I don't know if the bishops are going to do what the kids have asked, but we'll try.
Will you be talking to the Catholic Church as well as the pastors and the because sadly, about 6 years ago, the cardinals and bishops of Africa convened in Durban. It was a very nice hotel in the Shlanga Rocks, where there was rumours they were going to recommend to the Holy Father that they should allow condoms for the African male. And after 4 days, I should say, of prayer, crayfish and nice white wine, they decided that they weren't going to change it. They were going to redouble their efforts to make the African male monogamous. I suggest you should go to the Vatican with that research and really, really seriously make this, because I think I think that really is something you should talk to.
Yes, I'll let you know if we manage. That's a tough call. Yeah. Yeah.
You mentioned at one point that you corrected your data for rural versus urban. Rural versus urban and different economic status. Was there any other pathways to risky behaviour? I know we're focusing on HIV, but with your corrections, are there other factors that have a large impact?
It's a good question. We actually tested about 150 different factors, because we were trying to, we weren't starting from a clear idea of what was going to be happening. We were trying to find out. Definitely it all gets worse as the kids get older. So education problems, mental health problems, sexual risk problems, would expect that as kids get older. Some of them are different for boys and for girls. There's many more delinquency risks in urban areas where there's gangs waiting, and particularly the gangs target these very vulnerable children. When we went back after 4 years, quite a lot of the kids were in prison, and we went to visit them in prison, and we actually sent the same interviewers back. They were really delighted and amazed that these people had come back to find them. But they told us these stories of losing one parent after the other, and they said, in the end I had nowhere to go. And the gang came to me and they said that I could come and stay in their house, and I had nowhere to go, so I joined the gang. And then they told these horrible stories about being involved in murder and burglary and hijacking. And at the end of it, they said to our interviewers, will you come back and visit me again? Because no one visits me in prison. And you realise that there were these complex relationships going on, some of which we can't get here at all. We do also see that the parental factor and family factors make a difference. That kids where there's better discipline and a more functioning family, I mean, we'd expect that anywhere, do better. We've still got a lot more work to do on this. We had a question at the back, yeah.
Hi, you mentioned that education isn't enough in the scenarios that young people find themselves in. You mentioned a number of interventions, free school, attendance, etc. Have you got any idea of And what you recommend is a combination of interventions that would be most effective in this situation?
It's an absolutely great question, and this is exactly the question that the top people at USAID have asked us, and that's what we're trying to work on. We're at the moment mired in statistical problems trying to do it, so we can't answer. It's clear that combinations do work, but we're not quite sure in what ways and how much better they work. I'll come back in 6 months when we've worked that one out. We've got a team of statisticians stuck on it at the moment.
And I think we'll wrap up now.